Good morning and good afternoon, everyone. Thanks for joining FSMA Friday for March 2020. My name is Aaron Bolshaw, and it's a voice you probably haven't heard yet, and I'm privileged to be coming to you my first time as the VP of Marketing for Safety Chain as the new moderator for FSMA Friday. For those that don't know, FSMA Fridays is a monthly industry update for food and beverage facility operators, QA, safety compliance professionals all over. And we partner with the good folks at the Acheson Group to bring you all this great information. So we thank you for joining us. Before we get started with the introductions, just a few small changes in format for us today. We're continuing to see some technical difficulties stemming from our webinar platform, and it's just having to cope with all of the folks working from home right now because of COVID-19. So we'd actually pre-recorded this session, and so a couple of nuances there. If you're calling in from a phone, you may not hear things properly, and it is recommended to join by computer. Since this is pre-recorded, a couple of things, right? One, we'll follow up with everyone with the live playback with a link to view the entire presentation on YouTube. We want to make sure everyone has this. So if you're still struggling to get in, we'll have you covered very close to the end of this presentation. Continue to ask questions like you would normally. We do want to hear from you, and we'll follow up with you after the presentation. But for today, we have asked some industry leaders ahead of this to give us their pressing COVID-19 questions. So that's what you're going to hear today. And finally, we normally go about 30 minutes on FSMA Fridays, and we shut the door. We're going to take our time, go a little longer than normal to capture all the information Dr. Acheson and Dr. Miller have prepared. So, and with that, please welcome Dr. David Acheson and Dr. Ben Miller of the Acheson Group. Gentlemen, our audience is on the proverbial front lines, and what a week they're having.
Thank you, Aaron. Yeah, I appreciate that. It's changed significantly since the last time we did FSMA Friday at the end of February. I mean, certainly, I don't think many people would have predicted we would end up where we are right now. And, I think as we look to the next month, I think we'll be surprised to see where we are at that point as well. But we're excited to cover what we know, at least as the current science exists today as part of this call, and go through what our current recommendations are. And we've been supporting upwards of 40 companies, really throughout the supply chain in this effort. And so we're excited to share what we've learned and what we've been sharing with them.
Yeah, thanks, Ben. I can't believe it's already been a month. Time is certainly not acting like it normally does. But you and David have a ton of great information. Why don't you get started to just sort of overlay for everyone a little bit more about the disease itself?
Absolutely, Aaron. And this is David, and appreciate being part of FSMA Friday yet again. And as you gentlemen have just been saying, things are moving really fast. But let's just kick it off with just a general update in terms of what we've learned so far about this disease. The incubation period, which is defined as the time between the exposure and the development of symptoms. We know a little bit more about that now. Looks like the median is about 5 days, and by 11 days after exposure, almost everybody will be sick if they're going to get sick. There are a very, very few, and this is based on data out of China, that may go beyond 14 days, but it really is a couple of hundred out of the 10,000 or so that they studied. Anyone can get COVID-19 disease. We are well aware high-risk groups seem to do worse, the elderly, the immune compromised, those with underlying illnesses, but there was a perception that the youngsters were safe. We've learned, I think this is in the last week or so, month or so in the United States, as more cases have come to light, particularly in New York, that 40% of the patients hospitalized there are between the ages of 20 to 54. So this is definitely hitting people of all ages, and even youngsters can get pretty sick. Sadly, at the moment, there is no specific treatment. Rest, hydration, lowering fever, and obviously trying to self-isolate and prevent spread are sadly the only forms of specific treatment, even though there's obviously drugs and vaccines under development. So let's go to the next slide. Ultimately and fundamentally, we are about reducing the risks. Good news is for all our audience is that there's no evidence that this virus is transmitted via food or food packaging. The science has indicated that, the regulatory agencies have indicated that, authorities out of Europe have indicated that, so that seems to be a pretty solid fact. It is a person-to-person transmission. What does that mean, and how do we deal with it? The controls that we're going to be talking about during this session is very much focused on reducing that person-to-person transmission. We've learned avoiding touching the eyes, nose, and mouth is critical. Why? Because that's how the virus gets into the system. Hand washing is really important. If you wash your hands using conventional soap, warm water for the standard amount of time you would as a food safety professional, you'll get rid of that virus. Hand sanitizers, the commercial type, they work. Appropriate use of personal protective equipment is important, and we'll be saying a bit more about that as this webinar continues. As is social distancing. The key point of being 6 feet away from each other as much as possible. And again, we recognize in the food industry that is not always possible and certainly not always easy. So we'll get into that a little bit as well. We know the virus will survive in certain circumstances. For what it's worth, the good news is it doesn't grow in food or on a surface, unlike a bacteria which we deal with on a regular basis, which will grow in food under certain circumstances and certainly will grow on a surface sometimes. This virus does not do that. It needs to be inside a cell, a human cell typically, in order for it to multiply. You cook it, you kill it. Again, good news. So if there's any concerns, and certainly people have been concerned, they've raised concerns about food, cooking any food will destroy it. Does that mean it's going to pass through fresh produce? Somebody is probably thinking that. Answer, no evidence it's doing that either. We think it's highly likely it will survive at refrigeration and freezer temps, but as I said, it's not going to grow at those temperatures. We know from science that it will survive on a surface. Some of the recent evidence that came out was published in the New England Journal of Medicine just a week or so ago, which show the virus is going to survive about 24 hours on cardboard and 2 to 3 days on plastic and stainless steel surfaces. That's obviously important in terms of controlling the risk from contact surfaces. Not just food contact surfaces, but contact surfaces in everyday use. Doorknobs, handles, buttons, etc., phones, all of those things that could be contaminated with the virus. Again, good news, the virus is destroyed by most chemicals that we use in manufacturing plants. And EPA has published an extensive list of disinfectants that one can use against this virus. And that list is also available on our website in an easily understandable way. So good news is it is easy to get rid of. You just have to be careful you don't spread it. So with that general background, I'm going to hand over to my colleague, Ben, who's going to take you through some key thoughts on beginning with keeping sick employees out of your plants. Ben.
Thanks, David. As we work to try to address the risk associated with this virus, and we'll talk about critical infrastructure a little bit later in the presentation, but I think we've all recognized that the food industry is playing a critical role right now in terms of making sure that food is being made and distributed to grocery stores throughout the country. And that is an important component of making sure that people feel, especially people that are in shelter-in-place situations or under quarantine, feel like they have access to what they need. And so want to recognize the efforts that the food industry is playing right now and what an important role that is. In order to protect those operations, one of the key things that we can do is keep and screen employees when they're coming to work. So we're really advocating for regular employee wellness checks when they arrive for a shift, and sometimes more frequently than that. And we'll talk about situations where that may be appropriate. But checking in with your employees, asking about symptoms that they may be experiencing or may have been experiencing in the last 24 hours. The hallmark being fever, cough, and respiratory distress, so shortness of breath, tend to be the things that are most associated with COVID-19. So asking about those symptoms, asking about contacts with known cases. Are they potentially a household member of a known or confirmed COVID-19 case? And have they traveled to high-risk areas? And the high-risk area question is definitely a moving target. I mean, I think we first started with travel to China and then expanded that to Europe. And now, even within the United States, we're seeing areas that are definitely popping up as hotspots. So understanding where employees may have traveled within the last 14 days, they've traveled to any areas that may be considered high risk, that would be a criteria for self-quarantine and exclusion from work. If they answer in the positive to any of these questions above, a recommendation is that you record that fact and have them self-quarantine. They should also call their healthcare provider if appropriate, and emphasis on call. Obviously, we don't want people going into the clinic or the hospital if they're not symptomatic and overwhelming the system or potentially exposing themselves further. So calling their healthcare provider is recommended. And it's also a good idea to get contact information and stay in touch with those employees so that you understand what their ongoing health status is. Next slide, thanks. So if you do find somebody that is ill, what do you want to do? And actually, let's jump to the next slide. I think it'll pick up there. Thank you. So determine what their symptoms are. So if somebody calls in sick to work, let's say that's the scenario you're presented with. Somebody calls in sick, determine what their symptoms are, determine who their close contacts were while they were working. And close contacts are people that would have been working within 6 feet for more than inside a 6-foot radius for more than 15 minutes. And that's how we're defining close contacts right now. It's important to look back 48 hours in terms of identifying who may have been working with that employee when they started to feel ill, or if they were working prior to feeling ill. So let's say they were working yesterday and they called in this morning sick. You would still want to go back a 48-hour period from when they started to feel sick to try to identify who those close contacts may have been, because those people may need to self-quarantine based on their exposure to this ill employee. The other important piece of it is if you have somebody that became ill at work or even calls in sick, would be to understand when was the work area that employee worked in last cleaned and sanitized. That's an emphasis on cleaning and sanitizing those work areas is important because it helps reduce risk of potential environmental or fomite spread of the virus. It's also important that they stay in contact and continue to report their daily status as they reach out to their healthcare provider, and especially if they get a definitive diagnosis of COVID-19, then you want to have a communication plan in place and be ready to communicate both with employees in the company and also potentially outside the company, depending on what exposure that employee may have had with others. Let's see, actually, let's go the other way. I think we've got that slide duplicated again. There we go. I think the other piece there that didn't necessarily show up in the slide, but if you have somebody that becomes ill while at work, one of the important things to do is isolate that employee. So place them in an office or a closed environment where nobody else will be in that environment. And if they can't go home immediately, and help them find a ride home or help them get to a healthcare provider, depending on the severity of their symptoms. And immediately following that, identify the area in which they were working and clean and sanitize that area using, or clean and disinfect that area using an approved disinfectant on that EPA list that David was referring to. So when can employees come back to work? The current guidance from the CDC for those that have been diagnosed with coronavirus or COVID-19 is when they're fever-free without the use of fever-reducing medications and no longer showing symptoms, and have 2 consecutive tests collected at least 24 hours apart. I think we're going to see that recommendation probably change in the near future, given the lack of access to testing and the need to prioritize testing for those that have severe symptoms. So check CDC's website. This guidance will probably change, I would think, fairly soon, just given what I've said. And we'll have to see what CDC recommends for those cases that have had a laboratory confirmation in terms of being released from isolation and allowed to come back to work. For others that have symptoms, actually, if we just head back to that slide again, for those that have symptoms without a specific diagnosis, you want those people to go home and obviously not come to work. You want them to self-quarantine, and they shouldn't return to work for at least 7 days without, or at least 3 days without the use of fever-reducing medications. And it should be at least 7 days from their initial symptom onset, which is an important point. So if somebody gets sick today, they have to stay out at least a week, even if their symptoms resolve relatively quickly without the use of fever-reducing medications. And the concern around that is that it's possible that people can still transmit the virus even after recovery, and if their symptoms recover. So it's thought that an exclusion period of 7 days is sufficient to minimize the risk of transmission once somebody is recovered. The other important piece there is the improvement of respiratory systems. I know one of the questions that we've received is, do you have to have essentially no cough before somebody may return, because oftentimes cough can linger. CDC's current guidance recommends improvement of respiratory systems, although not full resolution of respiratory symptoms. That's somewhat subjective, but you would want the employee to essentially feel significantly better and demonstrate a minimum level of symptoms before they were to return to work. Next slide. Another important component of just managing risk to your workforce involves your visitor policies. Obviously, there are essential visitors that come and may service key equipment within your facility and perform other functions. Those visitors should be screened in a very similar manner to how you screen your employees, asking a similar set of questions. And if they answer in the affirmative to any of those questions, they should be excluded from visiting the facility that day, and not until either they have resolution of symptoms or a sufficient period of time has passed from a high-risk exposure like travel. Next slide. So what are some things that food facilities and food companies can do to reduce risks? When we think about reducing risk, the first piece is the employee screening. The second is really the social distancing or workflow modification processes that you can put in place. So what's your shift structure? Can you structure shifts in a way that you don't have overlap between shifts when they're coming and going to work? Can you designate shifts that may work on alternate days depending on your production schedule? So the goal there is to minimize the overlap that one group of employees may have with another group of employees, to minimize the risk of contact or potential transmission within or between those workforces. How do you segregate groups? One of the ways to do that is to think about staggering breaks within a facility, or making sure that people maybe report to work at a slightly staggered time. So your goal is to essentially minimize the number of people that can come into direct contact with each other. So if you have a break room, can you stagger your breaks based on, say, line within a food processing facility, so that one group is taking a break 15 minutes before another, and so you end up with 3 or 4 breaks in a morning or afternoon versus one break for the entire workforce. Again, the goal being you want to keep people at least 6 feet apart, because that will cut down on the number of close contacts that you may have to exclude from work if somebody becomes symptomatic. Another important piece is this hourly touch point cleaning in common areas. They have break rooms, locker rooms, bathrooms, anywhere that you have a lot of touching or hand touching of surfaces. Those should be cleaned and disinfected using EPA recognized chemicals on a frequent basis. Those will help minimize the risk of transmission from environmental surfaces. We've talked about the importance of social distancing, helping people stay at least 6 feet apart. For instances where social distancing may not be possible, there are settings, certainly some manufacturing lines where that can't take place just based on the way that it's physically set up, what are some options that you can consider as an employer? One, you may be able to install temporary barriers like plexiglass barriers that reduce the risk of droplet transmission between those employees if they're less than 6 feet apart. So if you have people working, say, 3 feet apart on a processing line, the installation of a temporary barrier may be an option. If you're doing so, you should be cognizant or consider any potential food safety risks that could come about because of that, either through potential physical contamination of the product or challenges in cleaning and sanitation that might come from the installation of those kind of barriers. Another strategy is to look at more frequent employee wellness checks. So when you look at having people working more closely together, you may be wise to talk to them about their symptoms on a more frequent basis. So when they come off of break or when it's lunch or when they go on a break in the afternoon, check in with them and understand, is anybody feeling symptomatic? What you want to avoid is a scenario where somebody comes to work and an hour later they start to develop a fever or a cough, and they've been working in close proximity with others on the line. That would require you to ask the other people who are defined as close contacts to self-quarantine based on their exposure to that employee. The other thing to consider is, how do you incentivize employees not to come to work if they're sick or if they have a family member who may be sick? So look at your policies. I know a lot of companies have been doing that right now in terms of figuring out sick leave and making sure that employees that maybe traditionally didn't have access to sick leave have access and can take the time off that's needed, especially if they're symptomatic. Definitely don't want sick employees coming to work. Next slide. So this is a poster that we've made available on our website. You can check out our website, and I think there's a link to that at the end of this presentation. If this is useful for you to put up in your facility, we'll be translating this into several different languages, and those will be available on our website if you reach out. Next slide. I think it's important as we look in the next couple of weeks to plan for increased absenteeism as we see the number of cases in the United States increase. Workers will get sick, and how do you plan, if you looked at which portions of your operation are most critical, and do you have adequate staffing for those lines within your production facility? Another strategy is to look at hiring on temporary employees. I know many companies, especially in the food distribution and grocery retail segments, have been adding employees at a significant rate given the increased demand for those services from consumers. How do you streamline hiring practices, and how do you minimize face-to-face contact? So conducting interviews either by phone or by Skype to reduce the risk of face-to-face contact. You may need to also consider waiving or triaging traditional screenings like drug tests and things like that to bring people on quickly. Also think about adding additional HR supervisory staff that may need to help bring those new employees on as well. You are actually allowed to ask about COVID-19 related questions as part of the hiring process. So if somebody were to become symptomatic or be diagnosed with COVID-19 as part of the hiring process, you may be able to withdraw the offer of employment based on that response. And good information on the EEOC website that speaks to that. Another really important emphasis is, as you bring new people on, you need to have quick and streamlined training that focus on the key aspects of food safety. Obviously, some people may not be coming from the industry and may not have a good understanding of food safety and what may be involved in their position. So think about how you can roll those trainings out in a just-in-time manner. Next slide. Finally, we've heard a lot, I think, in the food industry around critical infrastructure, essential services. So I mentioned at the beginning of the presentation, the role the food manufacturing industry and distribution and retail grocery, as well as restaurants and pharmacies and convenience stores play in ensuring that people have ready access to food is and will continue to be important, especially as we see more states move to shelter in place or restricted movement. So if there are questions about having your employees come to work, you can check out our website. We have resources there in terms of suggested language for template letters that people can use and you can provide to your employees. So if they are stopped on their way to work, it designates that they're essential employees. I think we've heard of a few instances of employees being stopped and asked where they're going. And so it's a nice tool to be able to put in their hands to make sure that they can show up to work and continue to participate in critical infrastructure. Next slide. Back to you, David.
Well, thank you, Ben. I'm going to finish this off with a few thoughts on FDA actions and where are we heading. The FDA have made it very clear that they support this notion that the virus is not spreading via food or packaging, as I mentioned earlier. They've also, in a recent announcement, said that they are going to stop routine inspections, both domestically and internationally, but they're going to continue for 4-cause or mission critical inspections, which basically, for those of you who are not FDA regulated, means that they will continue to follow up on foodborne illnesses for food safety, recalls, etc., which speaks to what Ben was saying, is despite all these challenges, we have to continue to keep a high focus on our food safety standards. They've also made a clear statement that they'll leverage enforcement discretion for the use of third-party audits as a component of the Food Safety Modernization Act. This relates to the requirement for your supply chain risk control, whether you're under foreign supplier verification or preventive control rules. There is a requirement for high-risk class 1 type situations to have annual on-site audits. They will relax that a little bit and let you use alternate methods, such as enhanced certificates of analysis or your own testing, or more in-depth review of your suppliers' programs to replace that requirement in the short term. I should comment while we're on this FDA actions that there are a lot of different strategies and requirements at state and local level. So this slide really pertains to those under the FDA guise. If you're meat and poultry, FSIS is going to continue business as usual, is everything that we've heard. Both agencies have stated that they don't have any intention of recalling food because a COVID-19 diagnosis has been made on a food worker. But a key message here is make sure you know, if you're operating in the restaurant business or the retail business, what your state and local requirements are, because they can be quite different. Let's go to the next slide. As we move a little bit into what to expect in the future, and sad to say, I think things are going to get a lot worse before they get better. This is a picture of the Johns Hopkins map that I'm sure many of you follow. We're tracking it. It's a great pictorial of what's going on. This is as of March 25th when we set up this recording. I can guarantee at the point at which you're listening to this, it will have changed quite a bit, with over 64,000 cases in the United States already. So this is going to continue to grow, sadly, unless there is a significant intervention in the near future in the form of a treatment. So we have to plan for that. As we sort of think about in the next slide, where to go, how to plan. Ben has done a great job at explaining how to put those controls in place to protect your workforce and to protect your business. If you're in the food and beverage business, which you probably are if you're listening to this, you're part of critical infrastructure, again, as Ben has said. We want to protect that. We want to continue to grow food, make food, process food, distribute food, sell food. That means we have to protect our workforce. And we need to be planning for the worst and yet hoping for the best. The trajectory over the next few months isn't very good. Employees are going to get sick, as Ben said. We need to plan for that. I know that people will get sick. You may not have had anybody call out sick with COVID-19 yet, depending on where you're located, or you may have. You may have already dealt with it. But even if you are in a low risk area, you do need to plan for that eventuality. Current estimates from the White House physicians are that about 60% of Americans are going to get COVID-19. That doesn't mean they're all going to get into intensive care units. Many of them won't even go to hospital. But that's a lot of people who are going to be out potentially for 14 days. So we have to plan for business disruption. How long? Who knows? But we are recommending you plan for at least 3 to 4 months, which takes us out to the end of May or June. That's the time frame we should be thinking about. We've said once, we'll say again, make sure your food safety programs continue to be a high priority. FDA may have backed off on routine inspections, but I can assure you they will be watching what's going on. There are recalls happening as we speak. There's still recalls going on, there's warning letters going out. So the FDA is continuing to do what it needs to do to protect the food supply. Will we have a future treatment? I sincerely hope so. Obviously, if you're tracking the news, you'll see that there are treatments in trial already. Some of them are using drugs that have been around for years, like hydroxychloroquine, that was used for the treatment and prevention of malaria. If that works, that's great. It has a proven safety record. We'll find out fairly soon whether it is working because those clinical trials are underway. A lot of talk about vaccines. Clearly, that is strong hope that we'll get vaccines. But the reality is that they are at least 12 months down the road from here. That's not because it takes 12 months to make them, but it takes 12 months to really show that they're safe and that they work. So in the next slide, as we continue to look into the future, we think about this whole situation under 6 phases. And we're moving through these phases, and where it starts out with is the recognition of an outbreak, and that was really at the end of December, early January in China. Over the next 6 to 8 weeks, it spread locally, it spread globally, and was designated as a pandemic, which basically means community-based transmission happening in multiple parts of the globe. That's exactly what's going on today. We then move into understanding how to reduce risks and manage challenges. That's exactly what we've been talking about. Now we're moving from number 3 into number 4 of the operational changes to manage these new risks, shutdowns, movement restrictions, people calling out, absenteeism, having to hire temporary employees. That's the phase we are in right now, and we'll continue to be in for several months. We don't know exactly how long phase 4 will morph into phase 5 and the period of operating under these challenging conditions, but we should assume it's going to be a significant period of time. And then eventually we'll move into recovery. When? I don't know. My crystal ball says by July or August, we'll be looking at this in a different way. But between now and then, things are going to get rough. I'm pretty confident of that, sadly. So I think that is what we need to be planning for. And final thoughts in the next slide. As we move into this, this is a very rapidly changing situation. The numbers are going up, the advice is changing. What CDC is recommending we do changes, the treatment hopefully will change. So it's critical you stay current. The advice that we gave out from TAG 2 days ago is not the same we're giving today because more information is being published. This is a rapidly changing situation. Many parts of the business, the food and ag space, are a component of critical infrastructure. Do look at that, see how you can leverage that to help maintain your business. Look at all your policies and procedures, all the things that Ben went over. That's what's going to keep you operating, and it's going to keep you safe. And more importantly, it's going to keep your employees safe. Do communicate openly about what you're doing. Employees are scared. We're all just a little on edge about this. Where's it going to go? How long is it going to last? So open communication is really important, especially as the message you give on Monday may not be quite the same as you give on Wednesday because the science has changed and we have to pivot. As I've already said repeatedly, plan for several months of disruption, and please don't forget your food safety basics. The FDA won't forget, you can't forget, and not only is the American population requiring on a continuous food supply, but a safe food supply.
Yeah, thanks, David and Ben. That's fantastic information, and I appreciate the time you've put in assembling this. I appreciate all of the hard work and diligence you both continue to make as we go through this together. Again, this is, as you both have said, unprecedented, and so we have to build this as we fly it, right? So into the recovery. So That moves us into a Q&A session. We do have several questions teed up, and I just kind of start working through them. And these are fantastic questions from people on the front lines of food and beverage facilities across the United States. The first one is, might we see new restrictions for physical distancing of non-essential staff around food production areas? Ben, can you tackle that one?
Sure, Aaron. I think that we haven't seen it yet, and it's possible that that may come. I think part of the challenge is every food operation is somewhat unique in terms of the way that it's set up and needs to function. Some manufacturing facilities are very dependent on having workers close together, and they may be deemed as essential staff. I think one of the things that we've certainly seen and recommended to companies is if you don't have to have an employee on site, so if somebody works in an office or can perform their function from home, we strongly recommend that. I mean, really, the fewer people you have at work in a single setting, the more you can reduce risk. So really, companies should be having those that are essential to their operations reporting on site only at this point anyways. So those that aren't essential to such keeping the plant running and the food made should be working at home if at all possible.
Got it. Good. Second one is very similar to that, Ben. Might we see new requirements for verification of cleaning activities, and what might those look like?
Yeah, another good question. I think there's always a concern, if you have an employee that becomes ill at work, and oftentimes we hear about enhanced cleaning that may occur if you have a COVID positive employee. You have to think about that a little bit too from a practical standpoint. Most of the time, an employee is going to maybe go home sick, or maybe even become sick at home and wasn't at work when they were symptomatic. Right now, it's taking at least 24 to 48 hours, and typically much longer than that, before they actually get a definitive diagnosis based on COVID testing. So sanitation activities that may occur would be well after the fact of somebody was in the facility before they were actually definitively diagnosed. So the best recommendations that we have is to have that increased cleaning and sanitizing, disinfection frequency, and especially the common areas. The good news is that most of the typical sanitation practices that would happen in a facility that use detergents and sanitizers will be sufficient to inactivate the virus. And if people have questions, they can look at their label of the sanitizing chemical that they're using. They can check that against the EPA list that we mentioned earlier in the presentation. And in terms of verification of cleaning, a lot of the processes that companies use today should be adequate. A lot of companies use ATP swabs and visual verification of cleaning. That's going to be a good standard to use going forward as well. We're not likely to see surface tests right now in the short term that look for coronavirus, just given where we stand in terms of the ability for human testing at this point.
Yeah, that's a good point. So, David, I'd like to ask this question of you. What documentation should be kept on actions taken if there is an employee infected or possibly infected with COVID-19 virus in a food production area or in an office area of food manufacturing? So what documentation should be kept on the action our facilities are making?
Yeah, that is a good question. And as Ben mentioned, this pandemic has relaxed some of the laws around EEOC and American Disabilities Act in terms of things that you can ask. You can ask questions about diagnosis and infectivity that typically you are not able to ask. Our recommendation on what records you're going to keep is essentially what you do in a given situation where you've sent somebody home or somebody's called in sick. So if somebody's called in sick with a likely diagnosis of COVID, then as Ben has said, you want to contact the close contacts, talk to them, take the appropriate action, do the cleaning and sanitation of that area. And I would recommend you document that. If you find somebody who is at work and you end up sending them home, document that. If you, through your wellness checks, you identify somebody who you have said, okay, you don't meet our criteria to come to work, I would recommend you document that. I think it's too burdensome to be documenting all the negatives. We're trying to streamline things here and not create a bunch of paperwork. But if you've taken an action, do document that. So the action you've taken, because you can link that in, obviously, to the follow-up with that person. Did they confirm positive? Did they have a clinical diagnosis? When did they come back? In the manufacturing and processing environment, I'm not aware that any regulators are asking for that. Our observations and experience, however, in the restaurant business, restaurants are closed, yes, but there's a lot of entities that are still open that were in the quick serve restaurant business with takeout, drive-through, curbside pickup. Many of those are still operating. Grocery stores similarly. We have seen many situations of local inspectors coming into those facilities and asking to see what they're doing to control the risks. And that basically means show me your protocols, show me what you're doing, and show me the records you're keeping. So while this may not be happening at the federally regulated level, it's certainly happening at the local and state levels. So those records can be pretty important in convincing, particularly those local guys, that you're on top of things. But
yeah,
nothing specific from the feds on that that we're aware of.
Okay, good. Another question for you, David. This person writes, the CDC states that the primary method of transfer is, quote, expelled respiratory droplets, end quote. We know this to be coughing and sneezing. However, there is a study suggesting the virus could be airborne for hours if aerosolized. Many of our employees and senior management are concerned about preventing the virus if it is viable for hours in the air. Any insight there would be helpful? What are the experts saying?
Well, certainly there's a study that I referred to around the contact surfaces and how long it survives, that was published in the New England Journal of Medicine, that did a very nice job at looking at how long the virus is going to hang around in the air. If you sneeze and you're infected, you are going to put out a plume of virus. Some of those will be what are called respiratory droplets. They're heavy, they fall to the surface, to the ground fairly quickly. Some of them are very, very, very small and may hang around in the air for some period of time. Obviously, if you are sneezed on, or you walk through a sneeze plume while it's still got virus in you, you are exposed to risk. There's little one can do about that in terms of prevention, other than isolation, which obviously is a strategy that doesn't work when you've got to go to work and make food. So we have to control those risks in other ways. That's what the employee wellness check is all about, trying to identify and exclude those that may be sick. You send the worker home that's sick. You exclude the worker that's called in and said, well, I'm not feeling well, I may have COVID-19 disease. So all of those things are in place. In terms of preventing that spread, as we've talked about, the social distancing, imagine you're walking around in a bubble. Those are the best things that we can do to try to prevent that risk. We're living in an environment where, short of staying at home, you're not in a zero risk place. You're not in a zero risk environment. And all of these suggestions and advice and guidance and requirements are designed to reduce the likelihood that aerosol is going to get you. It isn't going to zero it out. We're not in a zero risk game, unfortunately. We're in what's everything we can do to reduce the risk. And if you follow all the steps and the strategies that we've talked about, you're going to take your risk down as far as you can get it, which essentially is what we're all having to do.
Yep, indeed. Good. Another question here, Ben, I'm going to serve this to you. As with many other places, Colorado is experiencing difficulty obtaining tests. So we don't necessarily know if any person who is ill is positive for COVID-19. So this person is curious what other companies are doing in order to determine when it is appropriate to send employees with any symptoms of illness home. How are they monitoring those employees prior to their return to work when they are unable to be tested?
Yeah, it's a good question. I think anytime an employee starts to demonstrate illness that's consistent with coronavirus, that they should be excluded and isolated and sent home. And as we talked about in the presentation, contact or call their healthcare provider. And I think what we may start to see more of is just sort of symptomatic diagnosis of coronavirus where testing's not available. So if somebody has mild symptoms, their physician may say, you have symptoms consistent with coronavirus, therefore you have it and you should stay home. And in those instances, I think we're going to still look at the current CDC recommendations of at least 7 days since symptom onset and 3 days since resolution of fever with no medication, and then improve respiratory symptoms before that employee would return. I think the course of illness that we've seen is that it tends to last a fairly long time in most people that get sick that have symptoms. And so, it's probably going to be greater than 7 days, but it's good to stay in touch with those employees, understand what their healthcare provider has recommended, and keep track of what their symptoms and symptom resolution looks like.
Okay, great. A couple more questions, and I think we can wrap it up. This one is, I guess I'll ask David. The only question I would ask is, what is the role of local and state health departments in providing guidance to companies post-sanitation of a facility after a COVID-19 team member is positive? So the idea is there's a lot of different departments that are having a significant, they're weighing in. What's your guidance, David?
Absolutely, and we touched on this a little bit, I think, in earlier in the presentation as part of some Q&A. But in a federally regulated facility, FDA, FSIS, we really haven't yet seen local inspectors, health departments getting too involved in what you're doing in the plant. They're all over what's happening to the people that you're sending home or the people who are sick. Absolutely, it's their job. That's in total contrast to what we're seeing at the restaurant end. And again, when I say restaurant, I mean those operations that are doing the takeouts and the deliveries, curbside pickup, etc. And grocery stores. And anecdotally, Aaron, I was having a call with somebody today, and in their local jurisdiction, they operate a chain of convenience stores, and some of them are quite large, mini groceries. The local health inspector came in and said, you need to close your doors and you need to allow one person in at a time. Doesn't matter how big it is, it's one person, and you need to have somebody on the door monitoring that. It's not two, it's certainly not three, it's one. And if you don't follow that rule, we're going to close you down. And that was what the local required. Other places, nothing like that. So I think the message here is we've got many, many different, not just guidances, but requirements at the local level. Every county jurisdiction, every local health authority is I won't say they're making up the rules, but they're setting their own requirements. And to some extent, that is being driven by them trying to control the increase in cases. It's being driven by the concern that if the healthcare system gets overwhelmed, then healthcare workers are not going to be able to cope. The death rate's going to go up. The optics are going to be terrible. So they're enforcing, if you like, social distancing. Not always practical, not always realistic, but that's what's going on. So the message there is, wherever you are and whatever you're doing, do make sure that you're tracking with local requirements, because many of them are different.
Yeah, it's quite an interesting time we're working through. One final question, I'll let you guys fight for it. One of the biggest questions I have is in regards to best practices for sanitation. Most food facilities generally have pretty good sanitizing practices in place, but with Quat being one of the few EPA-approved surface sanitizers, is there more in sanitation companies that they should be doing to prevent the spread or likelihood of spread amongst our employees?
Well, I'll jump in quickly on this one because I think Ben really covered it. And that is that, we have to differentiate between food contact surfaces and food safety. That you don't compromise on that. You do everything that you've been doing, and those cleaning agents, sanitizing agents will kill the virus for sure. Different from that are those other touch points, those other areas which we clean, but we don't focus on. And now in today's environment, we focus on them. The elevator knobs, the phones, the handles for the restroom and the break room, all of those areas, which has been said, looking at the disinfectants and the cleaners that you've got in your armamentarium, in your facility, make sure that they're effective against the virus by checking against either our website or the EPA lists, and then you should be okay. So, you know, if you're going to use your quant on your food contact surfaces, keep doing it. It's going to kill the virus. You don't need to be reaching for something that you wouldn't normally use on your food contact surfaces. Stick with those protocols, and it feeds right into the other fundamental message here, is that food safety is still critically important, and don't let it slip.
Yeah, I like that message above all else that you shared, which is, you know, the basics work, what we're doing works, continue to do it, and stay vigilant is really where we're at. Well, we're going to wrap it up from there, but before we do, the Acheson Group has a plethora of great material resources. Please visit achesongroup.com/COVID-19 for more there. Of course, Safety Chain, we've got a whole library of content, and we also, in partnership with the Acheson Group, put together a COVID-19 readiness kit. Go and grab your kit there on our website. If you have just some random questions, we'd like to hear from you. Safety Chain set up a email, COVID-19questions@safetychain.com. Let us know what's going on. We're going to figure this out together as we go through those 6 steps that David was talking about earlier. And of course, join us next month. April 24th is the date we've got for the next FSMA Friday. And it is my sincere hope, gentlemen, that we all stay well enough that we're once again coming together and giving another great update like you fine folks have done for us twice now. So many thanks to David and Ben.
Thank you.
Thank you.
Stay well.
All right. Yeah, you too. And this concludes our event. Again, stay tuned. We're going to send everyone the recording of this. We're going to make sure everyone has quick access to this via very, very important information. So on behalf of Safety Chain and the Acheson Group, that's it. We'll see you next time. Thank you so much.